meeting is being recorded.
Okay, it's official. We're being recorded. So Genell and I got together because I run a home care business, and more than half of my clients that I'm caring for have long-term care insurance policies. So I'm on the end of when someone has bought a policy many years before and are about to use it. So I'm going to talk about how I work with those clients to maximize their insurance policy that they've already purchased. So I have up here the 7 elements that I look at when I'm helping someone review their policy. We can go the first 2, qualifications and elimination period. We can go to the next slide. So the first thing we look at is what types of things a family or the individual who has the policy needs to have or be in order to qualify to use the benefit. So it's either, and they can have both, but if they do not have dementia that's been diagnosed officially by a physician, they need to have typically in a policy at least 2 of these activities of daily life, sometimes 3, depending on your policy, that they cannot do independently. So just because you have a policy and you need help, you still have to meet these qualifiers. Now, if you're unfortunate to have been diagnosed with dementia, which Alzheimer's is a form of dementia, there's also Lewy body dementia and a whole bunch of others, but basically cognitive impairment, then you automatically qualify. But it can't be self-diagnosed or your family diagnosing it. You have to have an official diagnosis from a physician. And the last qualifier is that typically the policy will require that it be a care provider that's a licensed agency. And that differs by state, but in Tennessee, for example, we're licensed with the state of Tennessee under a specific agency, which means we're audited. We have certain requirements that we have to follow, ways that we have to operate. And every year I get audited. Last year in May, or this year in May, 100% no deficiencies, which is the 2nd year in a row for us. Awesome. Sometimes we have little things. We're missing 1 document, that is somewhere, but wasn't present when the auditor came or something like that. But the last 2 years, total 0 deficiencies. Okay.
Congratulations.
Thank you.
Yeah, really.
Thank you. So we look at this is the 2nd thing in the key elements is an elimination period. An elimination period is almost like your medical deductible. It's typically a period of time or a waiting period that the policy dictates. And these here are the typical lengths. You can see that most of them fall within 90 to 100 days. And they could either be care days or calendar days. Typically, it's care days. So if you think about it, 90 care days, that means we have to provide 90 days worth of care in order for you to use the money that you've been paying into the policy for quite some time. So especially with these older policies, I mean, the premiums, right, Tom, could be like $500 for the older policies, not some of the newer things. But so they're paying $500 a month for 20 years, and now they can't touch the money until they've gotten through this elimination period. And that'll become important in how we help seniors in my later slides. So the next 4 or 5 out of 7 here is the benefit amount. So how much does your policy pay out? Either by day, there's usually limits by day, and there's also limits by lifetime. So your policy is going to have a maximum amount, whether it be in dollars or in amount of care, hours or days. We're also going to have sometimes differences in the coverage depending on whether you're getting home care or whether you're in a hospital. And the benefit period sometimes has a limit on, even though there's dollars and days, it has a beginning and an end. So if you don't use that benefit from the time you start, the clock starts ticking to the time the benefit period ends, then you lose the rest of the benefit. Yes.
This might be a Genell question, but is ever indefinite? Is there always like 3 years or a definite date? There always is.
Not always.
Not always.
It's policy by policy. Yeah, and different things were in vogue different times. So most of what I'm talking about are older policies, and that's why we've partnered up, because I'm talking about those that bought them a while ago and are starting to use them. And we could say like maybe 30 or 40 years ago, and now they're 80 or 90 and they're using them. Okay, family caregiver. Some policies do allow someone in your family to be the caregiver, which is a nice thing. Typically, it's not a spouse or a sibling, adult child, typically. Some do allow it, but we have had situations where we've, and I'll talk about one of the things that we do. Is there a dog under there? Okay. Anyway, so that is something to look for also in the policy as a key element. And then the last thing is not all policies allow for premium waiver. What I mean by that, excuse me, is that policies may still require you to still pay that $500 even after you put the policy in place, while other policies will, after you meet a certain criteria, certain amount of days of care, they'll allow you to stop paying that premium. So you're almost saving money by using the policy. One thing I just want to mention about that, and I'll touch on it later, is that some people wait and wait and wait and wait, and then they don't end up using the policy in time, and then they leave money on the table. Typically, these older long-term care insurance policies with the cost of healthcare or home care or assisted living care is never going to cover the whole thing anyway. It's never a silver bullet that's going to answer all the expense questions or needs. So better to start it and use it fully as part of your care plan than to wait and wait and wait and wait. And then I have one client right now, Miss Francis, that we cared for her husband, and she did wait, and then he ended up passing before he used the full benefit. So now she's part of this program I'm about to describe. She realized I didn't have to sell her on it at all for her benefit because she lived it already. So we can go to the next slide. Okay, so this is unique to my company. We put this together and I call it long-term care expedited. And it's a, what I do is I sit down with the family and I review the policy in detail. And I take notes that highlight those indicators of those seven elements for them. And I recently did this for one of our Talk Shop members. I don't think she'd mind me mentioning it, Leanne Morris, for her family policy. And so I went through for her and just really found these the seven elements that I mentioned and just highlighted what they were for her to help her make decisions about when to pull the trigger on care and how to use the policy. I also, and that ties in with what I just said, I educate people on the qualifiers and I create a compliant care plan. One that if we do this care plan, then it'll meet the criteria of the policy and they'll be able to use it. And then I enroll them in the long-term care max, which maximizes their policy. So one of the things that if you ever call a home care business there and you ask them, do you have a minimum that you provide care, a minimum amount of hours? They're typically going to say to you, we don't come out for less than 4 hours. And that's really, less than that is really hard to schedule. You know, think about it. Somebody's working, they don't want to get up, interrupt their day just to go for 2 hours, 1 hour, 3 hours. So in order for them to make a living at what they're doing, they really want to have at least 4 hours. And so most home care companies will not take anyone on for less than 4 hours.
A day?
Yes, a visit. So it could be 4 hours in the morning or 4 hours in the afternoon, but every time they come, it won't be any less than 4 hours. What we do is we reduce that and we remove the, if they have a long-term care policy and they're trying to get through that elimination period. So I know that if I do a good job, they're not tied to me. They can go anywhere. We don't lock them in. We're not Verizon. We don't lock them in for a care plan. So they can go anywhere. I still have to perform. I still have to bring, good caregivers and do a good job for them. But what I do, knowing that at some point their policy will kick in, I'm willing to reduce the care visit time to be below 4 hours. And typically it's at least 2 hours. In order for the insurance company not to question it, not to say, what are you doing going for an hour? If I can wrap a good care plan around that 1 hour, sometimes they'll be okay with that. Like getting somebody up, making sure they have the hearing aids in, the phone's charged, they have breakfast, they get their meds, and then we leave is a good care plan for someone for an hour or two. Then the family, because they can't hear, can reach them and they know that the phone's charged, that type of thing.
So Marilla, the reason you do that is to be able to click off the number of days
Yes.
in that elimination period?
Yes.
Okay.
Yep. And I think I have a slide that touches on that, but if I don't, I will mention it. The other thing I do is we have an automated way to record what tasks we do every time we visit. So every caregiver has an app. And as they visit, they check off the tasks. And if the tasks are in line with the requirements of the qualifiers for the policy, then we have an automatic record. And in addition to that, we keep an updated care plan that moves along as their illness progresses. And we supply both the proof of the care, that list of things we do, and the expenses directly to the long-term care insurance company. So that eliminates, if you have mom who's 90, she may not be tech savvy, but the insurance company is requiring them to report what care you're doing, what's the cost, and when are you coming, and what's the care plan. We do that for them. We do it for the family. That's part of my plan. And then we make sure, we meet the required being licensed. So we meet that requirement. And we also allow, if the policy allows it, or not even, but we allow the family member to be a caregiver. Now, they do have to go through all the exact things every caregiver has to do. The training and clock in and out and be audited by me and all of that. But we do allow that. And sometimes family members are giving up their time already and giving up their career, the ability to make money as a career in order to care for a family member. And if you've got a long-term care policy that's going to help pay for it, why not utilize a family member? Why not give them a paycheck to replace their income? And we also monitor the timing of the full benefits. So we kind of look at, we check in every once in a while, where are we with that 90-day, qualification? Now to Tom, can we go to the next slide, or is that it?
That was it.
Okay, so to Tom's point, if you haven't figured it out already, which I'm sure you have, that if you have 90 care days that you need to get through, and if you wait until your family member needs 4 or 8 or 10 or overnight or 24 hours care, and you're not going to get paid from your policy until those 90 days are up. Just think about how much money, right now, home care is running between $25 an hour and $32 an hour. So if somebody's there 4 hours or 8 hours or 10 hours or 24/7, waiting for these 90 days to happen, I mean, you could do the math. It's a huge dollar amount. Yes.
If someone goes out for an hour, 2, 3.
Yes.
Does that count as a day?
Yeah, it counts as, we structure it so that it counts as either the day, or in the case where it's a care day. Yes.
Okay.
So some agencies are particular and we can't go below 2 hours. So like the client I mentioned earlier, she talked to her insurance company and they said, well, anything below 2 hours, we won't count as a care day. So now we schedule her 2 hour, we're there 6 days a week, 2 hours a day. So you can see how we would get through those care days a lot faster with a lot less money out of her pocket. So that not only can she tap into that benefit, but she also can stop paying that premium. So so I do charge a little bit more for a short shift because it's harder to schedule, and I throw money towards the caregiver, for the inconvenience. If they're only going for 2 hours, if they're just adding it to an existing schedule. But if I'm just shipping somebody out just for 2 hours, I'm going to pay them a few extra dollars, gas, make it worth their while. So you can just see how they would get through that 90 days, much faster with a lot less money out of their pocket. And that's how we help people utilize, but the key is to use it early. Yes.
How sticky is the insurance carrier about, somebody probably could make their own peanut butter and jelly sandwich, but one of the things that they need help with is feeding or cooking.
Mhm.
Is the insurance company going to be, I don't know if that person qualifies, or are they pretty good about letting them qualify?
They will I've not run into one insurance company that doesn't have a service. They all have a service that goes out and verifies what I'm saying. So they're going to come in and they're going to do a home assessment. So it might not be apparent to us that this person needs help with these things, but they could have, for example, like stenosis of the spine. Like the person looks fine, but it's painful for them to do certain things, or it's fearful for them to take a shower by themselves, that they might fall. And the ramifications for somebody with bone deterioration and pain to fall is huge. So they have to come out, they interview, and they do a home assessment. So that has to pass the home, I don't falsify things. So we have to be doing these things. If there's 6, usually 8 different, on that first slide, ADLs, activities of daily life that are qualifiers. So if they don't meet any of those, I have to tell the client, you don't meet the criteria. And some people will push themselves, they'll hurt themselves to clean the house and to take a shower so they're smelling sweet when we get here. And I'm like, I had that. Tom was working with me and we had to go out and try to convince this woman who was very ill that stop getting up early when we're coming and getting yourself prettied up and taking a shower by yourself. This is what we're here for. But anyway, any questions about that part? We had some good ones. Thank you.
She gave me the option of following her or going first, and so I chose to follow. I should have rethought that. I want to just give you some statistics. Now, I'm going to talk real briefly about long-term care at a high level when you purchase a plan today, and some of the things that you need to know as a consumer so that you can ask the right questions when you meet with your insurance agent. But first, I want to give you a couple of statistics. She mentioned the home health care. And she mentioned 23 to
25 to 32.
To $32. And for 2021, the average pay per hour for a home health aide, this is the home health agency, not the private pay, is $24 an hour. It is projected in 2041 that that's going to be $43 an hour, and I perceive that is a low projection. An LPN that associated with a home health agency is $124 today, last year. It's projected to be $225 in 2041. And for an RN, you pay $140 a day, an hour, excuse me. And in 2041, it's projected to be $252 an hour. So again, I think those are a little bit low projection for 2041 based on what we know 2022 is right now. But assisted living, They projected they said a 1-bedroom unit was $4,400 a month in 2021, and they're projecting that that's $7,900 a month in 2041. And I know that that's a low projection because I know that we have 2 places in Germantown, not far from here at all, that are about $10,000 a month. I don't know how people prepare for that, especially the middle-aged earner, the middle wage earner. So those are things that are important because many of us are oftentimes trying to just pay the bills for this month. We're not worried about the future right now, but when the future gets here, you're going to look back and think, what could I have done differently? What should I have sacrificed back then that would make me not have to sacrifice the level of care that I might receive today in the future? A nursing home in 2021 was said to be $257 a day for a semi-private room. I don't know about you, but I don't like sharing a room. So that means that's half of a room. That's not much space at all. In 2041, it projected to be $500 a day. So where did the money come from? How do you pay for that? You plan ahead, like some people in this room have, and you make plans so that you have a way to help fund that, so it doesn't take all of your funds sooner than later. I want to tell you about a story about a gentleman, a very smart gentleman, lived here in Germantown. He's 80 years old. He's still working. He's a realtor and a property manager of about 20 properties. He came to see me a few weeks ago and he said, Genell, I'm 80 years old. My wife is 78 and she had a stroke 3 weeks ago. I don't know what to do. He was terrified. He truly did not know what to do. 80 years old, smart man. I didn't think we would ever get where we couldn't take care of ourselves. It's what he said to me. And as much as we all try to do to take care of ourselves and to be healthy, the reality is as we get older, we're going to need more help. So we need to take time to plan for that now while we are working and have income coming in and not on a fixed income. But that just broke my heart. I can't help his wife. She's already in rehab. She was already going to the nursing home the next week. And I can't get anything covered on her. Now he's still healthy. Even though he's 80, it's possible that I might be able to get some coverage for him, but he'll have to go to underwriting. And you know that they're going to screen him closely because of his age. And so do something while you're healthy. That's even more important than the fact that you're working, but you have to do things while you're healthy to get coverage so that you're not left out in the cold in a crisis. So let's talk about, are all long-term care coverages the same? Mary Lou alluded to that a while ago, that each one kind of had it unique in itself. So you have to review each policy and see. I have 3 different carriers that I do long-term care with. One is a standalone. And to Mary Lou's point, if you don't start it in a timely manner when it's at the right time, you may pass away and not be able to use that. The downside of a standalone policy is you leave that money on the table. There's no way to recover that or to pass it on to your family. I do have a couple of other options. I have a couple of policies that I write as permanent insurance, and I add a long-term care rider to it. And that long-term care rider allows one to kick in when you have a situation that meets those criteria that Mary Lou talked about earlier, where you can start pulling the money, and usually for a period of time. Sometimes it's 3, 5. I have a 10-year option, but most people don't choose the 10-year option. I think there's a 7-year option as well, but it depends on what you're willing to pay for at the time. Another part that you need to consider is two different ways that insurance carriers pay. One paid by invoice. That means every time you get an invoice, from whoever that meets the criteria for long-term care, then you submit that invoice to the insurance carrier and they pay it until you run out of the fund, the amount that you set a long time ago when you first took out the policy that you wanted to set aside. The other option is monthly pay. When the long-term care is triggered and it begins, then you get a monthly stipend, no matter whether you use all of it or not, until the end of the term for that long-term care policy. So I don't know about you. I don't want to fool with invoices every month or keeping up with receipts. I already have enough to do to take care of my lovely parents. However, I know that for those, there are people who prefer to do things that way. They like everything in black and white and those details and all that. So that option is there for them. And then for those who don't want to fool with it, you can take monthly. You can start out with in-home care, like what Mary Lou offers. And you won't use all that money most likely for that period unless you're doing 24/7. But you can take that money, you set it aside, and then as you need it later, you can set it aside into something else and you'll have it for those other things that come up once your long-term care policy ends. So most people start looking for long-term care around 45. Most of my carriers don't usually write for people under 45 now. That's typically when I'm allowed to start that process, unless it's in a permanent life insurance, then I can do that. So questions you want to ask is, how does your long-term care policy pay out? When does it pay out? Is there a time limit for the use? What happens if I don't use it? And what services are included in the coverage? So those are all things that we can talk about in more detail if you'd like. That's a real high level view of it. And I think I answered some of the questions that you guys asked and confirmed some of the things that Mary Lou said as well. Thank you for your time. I'm out of time, Pat. We can do a one-to-one. Thank you.
This is such good information.